amazing range, you know, from death and bereavement and real massive concerns around mental health and the terrible challenges that people are facing, but right through to some of the connections and support and positivity. And I think it is that breadth that hopefully by working together and coming together and being connected, that we can gain some strength from that. And I know there are, you know, nods and lots in common that we have across all of those different themes. So thank you all for that. I will give you a really quick whistle-stop tour through some of the overview of Forum Central work, if that's okay. I'm sorry it was sent so late, but we have sent by email an overview of some of this, and we'll send it out again afterwards if anybody didn't get that. But obviously there's so much going on, and we don't want to take too much of the time in the meeting talking at you, but we did just want to just kind of acknowledge the breadth of work, really. An incredible amount of work that you're all doing in terms of establishing safe working practices for all of the people that you support and work with, as well as employ, and you know, that whole kind of workforce and volunteer, that sort of massive important resource around the people that we have in the sector, and the huge challenges around adapting to digital and remote working and responding to all of the shifts and guidance, you know, on top of our usual challenges that we would have at this time of year. So it's been an incredibly busy and difficult time for everybody. Qualities that Caroline mentioned has been really key for so many of us, and responding particularly around Black Lives Matter and making sure that we're really making time to think and do some work together around what we can do differently and what we reset and change, as well as making sure that we're meeting kind of current challenges. So we've got events and information around that you've had. We've really pleased to be doing some brilliant work around the community healthcare strategy. So a joint strategy between us and Leeds Community Healthcare. Other statutory organisations really keen to work in this way too. And some of this came out of some of the third sector resilience work. We raised issues for the sector, and Kerry very helpfully through PEG has been a real champion of all of the challenges that organisations are facing, and we are repeating the survey that was done. So really trying to keep that on people's agenda, and long-term funding and the need to recognise how insecure so much of the sector is. But also we've been trying to make sure that we're nurturing and supporting people in the sector. And Karen and Rachel have done some brilliant work around a sort of summer time out program that's been trying to support third sector workers and volunteers, and encourage people to look after themselves through all of these difficult times. We continue to provide loads of information around shielding and volunteering and all of the system reset. So hopefully you find that information useful that comes out every week, and do always give us feedback on anything that's useful or that isn't helpful or that you'd like more of. We've been working with the clinical commissioning group and the whole programme around commissioning. Gina came to our session from the CCG back in January, and on the back of that we've been developing that conversation around what will commissioning for outcomes, putting third sector at the heart of that change in how commissioning is seen around pathways and outcomes and people. So that's an ongoing piece of work that Francesca's linked, I know, with a number of you. We talked about it in our last meeting, and lots of people have followed up with her, which has been incredibly useful. And we'll be coming back out with something for conversations and consultation in the next month or so around what do we as a sector need as an alliance and a mechanism to make sure that everybody can connect with what commissioning and how services are shaped and altered and delivered in the future needs to look like. We've been doing some brilliant work with public health around the outbreak programme and plan for the city. Leeds has been incredibly innovative in seeing the value of communities and trusted existing networks in communities around outbreak planning, and making sure that both messages go out in ways that people can hear them, and languages and accessible formats, so that people get that, but also that the system hears back what it's actually really like for people. And there'll be more to follow on that work. There's updates included in the pack around brilliant work that Older People's Forum are doing, again around Black Lives Matter, and making sure that we're thinking about racism and diversity and all of those issues, and plenty to engage with around older people. Obviously the loneliness agenda has been massive and very much at the heart of the inequalities work too. Mental health, an enormous area, and we've got a separate members meeting coming up, so do go to that. But we particularly wanted to flag some of the messages around suicide. It's Suicide Awareness Week next week, and there's an opportunity to really highlight and promote positive messages around that, and make sure that we're all doing everything we can to link people and make people feel connected and cared for and supported and aware of what's out there. The learning disabilities kind of section of our membership have done some brilliant work around connecting and sharing information and working really collaboratively. So do again look at that information in the pack. Physical and sensory impairment network as well have worked tirelessly to make sure that access and the needs of people who can easily be forgotten in all of the big shifts and changes that are happening. And again, there's a meeting later this month of members particularly around that. So a vast array of work to tell you about, and really important opportunities to link in and connect. We also just want to mention to you that we're very much linking you in and representing you at West Yorkshire and Harrogate level. Some really big strategic conversations happening, and the West Yorkshire and Harrogate board, as all of the shifts and changes around, there will be big changes in the landscape at that West Yorkshire and Harrogate level that are happening, and making sure that the third sector has a voice there. And there was a strong commitment for long-term funding of the third sector, and a really strong recognition of the value of the third sector in terms of health inequalities and inclusion and all of those important agendas. So kind of wanted to make sure that you were hearing that that is being heard. And Alison, I know, has been chairing, there's a voluntary sector group of the work that's happening around the racial inequality review that's happening at West Yorkshire and Harrogate level. But also on a much more practical note, we've been able to secure funding around health inequalities at West Yorkshire and Harrogate level for a number of organisations in Leeds, and Leeds organisations working across the bigger patch. And we've also got some additional, we had some brilliant news yesterday from the lottery actually, who've been able to take some of those applications and fast track them through their system. So from the strategic right through to the very practical, we're trying to do everything we can to support the organisations that are our members, and to make sure that the things that matter to you are being heard. So yeah, whistle stop tour there, but hopefully that gives you a bit of a sense. And obviously do come back. I don't know if anybody's got any particular questions now. Do use the chat. We can either answer questions there now, or people, we can follow those things up afterwards if that's useful. Any particular questions on any of that? So I'm just trying to keep an eye on, it's difficult. We've got 30 people, which is got to be heading towards a Zoom record. And welcome, Alison. Hi, good to see you. If there's no specific questions, let's move on and welcome Caroline and hear the perspective that you're going to share with us today. Thanks, Caroline.
Thank you very much, Pip, and hello again, everybody. I'm mindful that I've got, about 15 minutes to talk. There's a lot to talk about, so I'll do my very, very best to keep to time. I'm going to start with the not so good stuff, if you don't mind, and try and get that out of the way. To some extent, that will also frame the rest of what I need to say too. But then, the rest of it is all positive stuff. So let's get the negatives out of the way. I'm sure because you are so well connected as a broad sector into the work that we do in the council and in the CCG. I'm talking specifically around sort of the Leeds City Council position, and just really to flag up the dire financial circumstances that all local authorities are facing currently. Leeds is probably one of those that is on the highest list of in a really difficult position, because we didn't do so well in sort of fixing the roof on our sunny days, and the leaks are now having a massive impact in that we don't have masses of reserves. We've got reserves that will help us hopefully see through current year. We're not in a position that we're sort of saying we can't meet a balanced budget this financial year, but we are not yet comfortable and confident that we're going to be able to achieve a balanced budget in the next financial year. Now, just really briefly, we were already in a very difficult position. We were already pre-COVID had a funding gap of 60 million for the next financial year, and we're already in the process of making and finding sort of savings and efficiencies and doing things in a more sort of efficient way to meet that shortfall. But then, of course, COVID came along, and whilst central government has allocated some funding to local authorities to cover huge additional costs arising from COVID, it is nowhere near the amount that we have had to spend in addressing and working towards supporting our communities during the COVID pandemic. So our funding gap for the next financial year 2021-22 is a staggering £139 million. So we're in the process now of looking at a whole range of different things as to how we can meet some of that shortfall. Some of it is looking at our capital receipts and seeing what we can kick down the long grass for a while so that we don't have to make repayments next financial year. Others are obviously canvassing government around what additional funding might come our way to help local authorities generally. As I say, we're not unique in Leeds, it's all over the place. So we know that government has got to do something to help local authorities to overcome the costs and the loss of income as well that we've experienced as a result of COVID. So there's those pressures, but nonetheless, we still have to find significant savings. We can't not. We can't go into the next financial year and say that we're not going to achieve a balanced budget. That's illegal for local authorities. NHS organisations are able to not have a balanced budget, but local authorities, we're not allowed to. We have to declare bankruptcy in effect, and we have then what happens is that we get central government coming in and telling us exactly how we are going to deliver or reduce our sort of financial pressures and reduce delivery of services so that we can turn it around into a balanced budget. And we obviously, you appreciate, we don't want to do that. We don't want to be in that position. So at the moment, what we're doing is we're presenting to our elected members a whole series of options. We're doing service reviews around across the whole board of the council, including adults and health, around where we can deliver some savings. And we're looking to propose something in the region of £30 million worth of proposals. We will take that to our executive boards during September and October with the sets of proposals that we're thinking through. And what we will ask elected members is to approve the process of consultations. That's when consultation will begin over that sort of winter month, sort of October, November, December, before any proposals are then firmed up and implemented. Obviously, we're also looking at our staffing levels and our staffing costs, and introducing a process of voluntary redundancy through early leavers initiative. And we think that that will help with some of the financial pressures. And I don't think I'm going to say any more around the dire finances, but please bear that in mind in terms of the rest of what I want to say. So huge amounts of work happening. Most of it is happening sort of in a very integrated way between the council and the CCG, and also our third sector organisations. We're making sure that everything we do is done in a very connected and joined up way, because we absolutely see the critical role and in fact, you know, the very significant and sizable role that our third sector organisations and our communities play in successful delivery of health and care across Leeds for all of our communities. So I suppose there's something to talk about in terms of COVID and COVID restart. We're part and parcel of the stabilisation and reset work that is happening through NHS England. And part of that, obviously a lot of our statutory services have continued, as you all know, our care home provision, our home care, particularly to support our most in need people to remain living at home. We've had also a whole number of other services that have that were ceased at the point of the height of the COVID pandemic, and mainly that is around our sort of day services and our support to carers and those sorts of services. And we're now gradually beginning to see the reopening of those services, and more in the way of not just virtual contact, which is in itself has really been fantastic, that we've had our service provider, day service providers maintaining contact with people through telephone, online, and where possible through social distance measures, some face-to-face contact as well. We're now beginning to see day centres and building-based services begin to open, albeit in a very sort of reduced way and a gradual way. And we're really pleased about that, because obviously we are really quite concerned around the sort of the impact that no contact has been having on people who have high levels of needs, and also on their families and on their carers. You know, really concerned. We know that many people were not presenting who would otherwise have been presenting, either in a hospital or to local authority to social care. We weren't getting the levels of people knocking on our door during the height of the pandemic, and so we know that there will be, we will expect that more people will come our way. However, that said, we have increased the numbers of people receiving home care. Fewer people, rightly so, and you can understand why, have felt confident in sort of looking at a care home placement, or even having their regular respite in a care home setting. And so what that has done is that it's increased the number of people looking for support to help them stay at home through home care. So that those things are continuing, and we anticipate that they will build up over the winter period. We certainly expect them to, and in the, obviously in the winter months we also see an increase in levels of need, particularly with our sort of more aging citizens. So that work, you'll be pleased to know, is restarting, albeit gradually, albeit very much within the context of infection prevention control. We also have really good news around the availability of PPE. You'll know that it was limited in terms of availability of protective equipment for people. Well, now that's being expanded to other non-registered services, so not just residential and nursing care, not just home care, but in terms of services provided around day support, around street support services. So we now have a pipeline to allocating PPE to organisations, including third sector organisations that do face-to-face work with our various communities. So that's really fantastic, really good news.
Yes.
If I can just then talk a little bit more broadly around some of the areas of work that we're focusing on. We've done a huge amount of work around supporting care homes during COVID. We're working now hand in hand with Health Watch, with Carers Leeds, around supporting care homes to reopen up to visiting, albeit within that very safe sort of context and minimising any sort of risk to other residents. I hope you'll be aware, I'm pretty sure you will be aware, that the numbers of COVID cases, transmissions and levels of infection are rising in Leeds. We haven't yet had stricter measures, but we anticipate that we might. And the biggest age group there that is impacted in terms of levels of transmissions are the age groups of between 18 and 30. And you know, healthy people, many of whom then aren't being adversely impacted. Either they're asymptomatic or they have very little in the way of symptoms. But our worry is that their connections and their connectivity through their families, through going out and about, whether that then transmits to our more citizens who are perhaps a little bit more vulnerable in terms of their health needs, and particularly people who are older. So we've got to balance the well-being of residents in care homes and their need to see their families with protecting them and other residents as well, and not having the virus being brought into the care home setting. So huge amount of work happening there, and balancing work too. One of the really exciting things we're doing is in relation to home care. Again, organisations will know that home care in its very traditional sense of time and task doesn't go well, isn't very personalised for people who receive services, but equally it isn't good in terms of the workforce. It's not an attractive role, particularly very low paid, and doesn't have very many benefits. And we're running a pilot which started yesterday. It's an 18-month pilot with two of our organisations or providers. One is Be Caring, which is a community led initiative and organisation, and the other is Springfield Home Care or Care Services. And they are looking at a very different model of delivering home care, which is around building on our ABCD approaches, our assets-based community development, focusing very much on what our communities and our neighbourhoods offer by way of support to people to prevent isolation and to help people to live a good life. And that's something that we're really, really keen to explore, and really moving away from time and task and delivering on the basis of how people's well-being, their mental well-being, as well as their health needs, linking in with our LCPs, local care partnerships, to offer a much more integrated and multidisciplinary support to individuals. So we don't get individuals who are getting health through district nursing, etc., through community health care, but then receiving a very different and separate home care visit once a day, 3 times a day, 4 times a day, whatever it might be, but actually bringing home care services into the whole set of multidisciplinary services that go into an individual's home. And that really big expanse of getting people back into their communities wherever they can, not necessarily even physically, but if possibly remotely, but through different means, keeping those connections strong with their local communities. So that started yesterday. It's an 18-month pilot, and what we're hoping to do is learn whether that's impacting and delivering better outcomes for our older people, and if so, how we can roll that out across all of our other home care provision. I could talk about that alone for most of the day, but I'll move on and I'll take questions on that if they come up. I mentioned ABCD. Again, we've done quite a lot of work with developing that ABCD approach with our community, some of our community organisations, and we're seeing good results in that. And what we're wanting to do is to look at how, and I think it was Pip, you mentioned this very early on when you started this morning, about how do we look at commissioned services which actually are not separate to what the communities develop, but start to link those together. How do communities inform and shape the services that we need to commission, that are statutory services, as well as the other discretionary services that we provide? How can we provide daytime activities that are different to, here we go, we're commissioning traditional sort of day services? How do we bring that ABCD approach? So we're beginning to think through, I mean, it is early days, but beginning to think through around how we get our communities to drive and determine and shape some of our commissioning intentions and our service developments. Again, you've mentioned a lot of work happening around winter planning, and together with the CCG, and as directed through NHS England, we're looking at that home first approach. And we can't do that without community organisations and our third sector organisations. We have some services that we work with in terms of, like with Age UK, around hospital to home, those types of services. But how can we get people back into the community, back home, or into sort of rehabilitative services that support them and help them recuperate out of the hospital setting, so that they can return home, rather than saying, well, our options are limited, let's find a care home placement for you. We recognise, and then COVID has really brought to light how important it is that we do our best to get people home first, and then at that point to determine, well, can they be appropriately and suitably supported to stay at home, or actually has the point come up by which they absolutely need to be in a care home setting. So really trying to emphasise and support and really move funding away from sort of care in a setting and care instead into people's own homes. We're looking at work we can do with Val and with carers leads around, again, making sure that we don't forget our carers and start to support carers in the way that in the best ways that we possibly can, bearing in mind what limited support they've received over the COVID period, how many of them have felt quite isolated and left alone. And we really want to make sure that the services that they need, that carers need to support them to continue in their caring roles, are brought back up again. I mentioned touched on very briefly around the sort of Black Lives Matters, and how we recognise how inequalities have really adversely impacted on some of our more disadvantaged communities, and the deprived areas that we have across Leeds particularly. And we really want to do what we can to sort of identify how we can look at the impact of discrimination and racism as well, through our institutions, and how we can redress some of the inequalities that occur as a result of that. And this, again, we can't as a council do this in isolation. We absolutely are led by and supported by our community organisations to ensure that we're absolutely getting to the heart of those deprived areas and offering support in a way that is meaningful to those communities, and really addressing not just health inequalities but social inequalities as well, looking at issues more broadly around housing and housing support, etc. So huge amount of work happening there as well. I know that you've got Aidan Smith coming to talk to you in a future meeting around the work we're doing around learning disabilities. Again, we've got masses of sort of review work that has been happening over the, pre-COVID, over an 18-month period. We've reviewed all of our day services, and we're looking at respite services as well. We've done a respite services review, and we want to go out to consult on those. I won't say any more on that because you know, Aidan will talk to you a little bit more around that. But when the time is right, and when we've got member approval, we will of course start that consultation, which will absolutely have our community organisations feeding into that. I think I'll probably just stop there because I'm mindful of time, but I'm really happy to take questions. I will catch up on what messages there are also on the chat and take note of those while people ask questions.
Oh, thank you, Caroline. Yeah, there's one question from Jess, which we'll come to, but yeah, just thank you for such a kind of honest and open and kind of wide-ranging overview. I think it's really heartening to see that people in the local authority are really kind of engaging with a lot of the same agendas and are really seeing that kind of shared desire to make things more personalised and to kind of take the opportunity, you know, particularly around, you know, the home care, which could be just a difficult challenge that, you know, could draw up shutters, and it really feels like you're doing the opposite. You're seeing that as a real opportunity to think about how to reshape that and link it in with local care partnerships. And great to kind of see those connections and those partnership discussions. Really great to know that you'll be engaging around the review, and Aidan's coming. If anybody wants information about that session, it's the Learning Disabilities members session. We can make sure people are connected in with that, but also, you know, huge recognition of the massive challenges around finance. It, you know, there's such big numbers, it's hard almost, isn't it, to take them seriously, but it's just an incredible challenge on top of so many other challenges. So again, thank you very much for your kind of honesty and openness around that. So Jess's question was particularly around what's the 30 million proposals, that presumably that's the adults and health bit of, so 137 million was it across the whole council, and presumably different parts of the council are having to look to find savings. So you mentioned a figure of 30 million, and Jess's question was, you know, if those proposals that are going to elected members have a particular impact for third sector, voluntary sector contracts.
So the 30 million, I'm afraid, actually it's probably good that it's this way. It's not an adults and health alone set of proposals. It's a council-wide set of proposals. So the 30 million that we've got, 20 million on the sort of, this will partly answer Jess's question as well. We've got two lists of proposals. We've got the sort of more sort of the business as usual, slightly less impact on our communities, on our organisations delivering care, on our citizens. So we've got a sort of list of proposals, and then we've got what we call the B list or the reserve list, which are a little bit more tricky for elected members, because without a doubt they mean a reduction in service or you know, some sort of negative impact in our ability to continue to deliver as we are doing. So that 30 million is across the board, the whole council. So to some extent that's good news that it's not all adults budget, but it's bad news in that that means that there is even more to find, significantly more to find. And we are being tasked now to go back into our specific directorates to look again. Specifically around the question around does it impact on any voluntary sector contracts, you know, in honesty, we've looked at everything. We've had to look at everything, and that includes all of our commission services, on our anything that is not a statutory service, so sort of on our more discretionary services. We have had to look at those. That doesn't mean that they're on the list. At the moment, they are not on our first tranche of list. They might well have to appear at this next stage of going back and looking again whether there is any scope for reductions around our community, our third sector contracted services as well. So this is not going to be in any way appealing to our elected members, and we're very mindful that it appears, but it appears on the bottom of the list rather than the top of the list. But we've had to look at absolutely everything we do. We've got very clear messaging from our elected members that what they want to do is they want to continue their absolute focus and priorities on addressing inequalities. And therefore, you know, the services that within adults and health that we commission are all about addressing inequalities and addressing ill health and social inequalities as well. And therefore, you know, to some extent, we feel that there's a level of protection, if that's the right word, in that elected members do not want to see us looking at reducing services that support those communities that are most disadvantaged and the areas that are most deprived in Leeds. So I don't know if I'm fudging the answer there. Okay, thank you. In reality, we've looked at it, but at this moment in time, elected members are not so mindful to go there. But we don't know.
And that's really clear, Caroline. And just to say, like, we understand, I think we all appreciate that we work as part of the system, and we're an integral part of that. And the transparency and the conversations are what, I mean, I don't know if I'm not speaking on behalf of everybody here, is kind of what's needed. So as long as we know, we can help plan and work with you for that. And obviously we understand that you understand that we're working with the kind of most vulnerable and addressing those health inequalities. So it wasn't a challenging question, it was more of an inquiry.
And I think that leads really well to Lee's question, which is to ask Caroline if there's anything that the voluntary sector can do to support Leeds City Council to receive more funding and to, you know, presumably kind of make the best of what we have as well. Do you want to come in specifically, Lee, or have we captured?
No, I think you've captured it. It's a pretty straightforward question. Is there anything we can do?
So I, to be quite honest, I'm hoping that there is. I think we are constantly going back to government to say that we can't meet the needs of our communities if our budgets are going to continue to be constrained. Certainly, we've gone back to government, as have other local authorities, around help. Further financial help during and to manage COVID, because we know that the pressures relating to COVID are not gone away. They won't go away yet. We're anticipating that more will be needed by way of support to organisations to prevent transmissions further. So certainly we're asking for short-term funding, because again, one of our biggest shortfalls is in income, because we've not been able to continue to deliver services across the board, leisure services, etc., which have previously generated a lot of income. So yes, I would say everything and anything that any of our organisations can do to lobby government to say that local authority funding needs to be directed at supporting our deprived communities, and what funding is available specifically targeted at our communities. That would be really, really helpful.
Thank you, Caroline. And I think that kind of points to the wider element that we haven't really talked about today, but just the way in which the third sector and communities and volunteering and all of those different elements around social value and communities and that sort of use of what we have locally has really come together in times of COVID. And it's really good to hear that kind of health inequalities and the wider inequalities is very much in your thinking, because we believe passionately that we have so much to contribute to this, and that there's really good value and really a lot to be achieved by working together. But equally, you know, as Jess says, we really want to have those kind of transparent conversations and be part of the solution, and recognise that we also need to help and, you know, do things differently, or accept that, you know, there will be challenges that we need to share, and that's part of being in the system together, that we kind of feel, you know, a shared sense of responsibility for helping make things go well. Does anybody else have any comments or questions? I know people were listening so intently, Caroline, and I think it was incredibly helpful to hear that directly from you. We really do appreciate that opportunity for you to kind of come and to hear exactly where your thinking is at. I don't know if anybody else wants to put any particular comments. Kerry, I know, you know, somebody who's very involved in the Partnership Executive Group of the Health and Wellbeing Board, you know, you're aware as well that there are conversations, aren't there, about how together we move as a system on a lot of these challenges.
Yeah, absolutely. And I think there's certainly an enthusiasm to keep this on the agenda and to keep thinking about how the third sector is protected. And I think what you said earlier, Pip, as well, about that's a conversation it's definitely a conversation at PEG, so a Leeds conversation, but also at the end of Rob Webster was talking on Monday at the end of the West Yorkshire board, which you were probably at, Pip, and he was asked if he had anything else to say at the end, and what he chose to say was about how important the third sector is, and how we're not an add-on, we're not something extra, we are an absolutely integral part of the partnership. So I'm really clear that people are saying the right things, but alongside that, there's the fact that the funds are limited. So, but I think our voice is, as you know, is as strong as it's ever been. It would be my assessment.
Thank you, Kerry. Yes, no, and that is really good, isn't it, to get that West Yorkshire and Harrogate recognition. And yeah, I think what we need to do is keep that kind of strong voice across and make sure that we're continuing to kind of work with colleagues, you know, where that's appropriate across West Yorkshire and Harrogate as well as locally.
Pip, can I butt in?
Absolutely, of course.
Thanks. Caroline, a question around the service review. So it's good to hear that the service reviews are going on. And I appreciate from a local authority perspective, it's difficult to get people round the table early on in those conversations. But I suppose given the work that happens across the sector, the earlier, well, I'm not sure it's a question or a statement really, but the earlier that we can get involved to work alongside statutory sector partners in those service reviews, the better really. Because I'm sure that there are a number of organisations that have got things that they could bring to the table during the early stages. I appreciate that you've then got to go through all the member hurdles before going out to formal consultation, but I suppose my request would be, if there is an opportunity to get us involved in each of the specific service reviews in advance of coming to conclusions about what will be consulted upon, that would be much appreciated.
Yeah, if that's okay, Pip, I'll just answer that. Certainly, Andy, my understanding around sort of, I've not been directly involved, but my understanding around the work that has happened around the day services review and also the respite accommodation review has been formed by talking to the organisations that are delivering the care and support services. So they've been included. Probably not the broader third sector per se. Is that the perspective that you're indicating?
I think it's both from a provider perspective and across the sector more widely. If we're moving towards a more asset-based community development approach, which I think most organisations would really welcome, I suppose most of the third sector organisations are really steeped in that kind of work in the first instance, so that, you know, just getting people involved at an early stage rather than at the point of time of proposals would be really good if possible.
I think that's really helpful. I think from a commissioning perspective, we're in a very early stages for statutorily commissioned services. what does ABCD look like. We're at the very early stages, and I think that you're absolutely right that it shouldn't be the commissioners that are driving that discussion. It should be our organisations that are already doing ABCD, are already part and parcel of the communities, who should be telling us how commissioning can be changed and enhanced and led by ABCD approaches rather than the other way round. So I agree with you, but we just need time to get there.
And one of the things I would just remind, everybody, I think we take our role as being a sort of bit of an honest broker and a representative across a range of different perspectives very seriously, Caroline, because I know sometimes it can be quite difficult, or it can be felt that it might potentially be difficult to involve providers, but actually I think as a sector we've proved that we're really good at stepping outside of our organisational hats and being able to bring that kind of wider view. And we've certainly got mechanisms of involving people who perhaps aren't always directly involved. Or so is that perhaps a conversation we could pick up, Caroline, to kind of see how we can help support that?
I think that would be really helpful. Yes, please, Pip.
I think one of my big learnings in recent months is just how having third sector and community voices around every table that you can get them does change the conversation and brings an added richness, which isn't always about being an equal partner or having kind of money in the game or whatever. Actually, it's just a really valuable thing to bring those additional connections and perspectives and breadth of experience and knowledge. So yeah, we would always advocate for that. And one of the things that we should have mentioned in our update actually is that we're recruiting a new role which will support around advocating and representing for the sector, along with a really exciting role that's around supporting the outbreak planning. So we're really pleased to be able to kind of have some additional capacity to the team that helps us do more of these things. Because along with Healthwatch and lots of other partners, I think bringing those different voices into conversations has partly been what's helped Leeds to be in the comparatively strong position that it's in. So massive thanks. Unless anybody's got any other comments for Caroline. I'll hand over to you, Ian, if that's okay, to talk us through where we've got to in terms of the sort of seasonal planning and the really important role that you take in representing a breadth of organisations, but also obviously the Oak Alliance and Age UK in some of those discussions. Thank you.
Thanks, Pip. Morning, everybody. Pip asked me to give a brief overview of where planning for this winter has got to, and the focus. The reason I'm involved primarily is because of our hospital to home service, which is obviously commissioned by Leeds Community Health and the CCG to deliver support to people being discharged from hospital. And so over the past couple of years, when the winter planning cycle has occurred, we've been asked as a single organisation to contribute to that in terms of what we will do in terms of our response. This year, and each year when that cycle's come round, I have made the point, but it's not necessarily been picked up on, but this year in particular it has been. I made the point that outside of what we do in the hospital, there's a wider third sector context that could be taken into consideration and should be taken into consideration when thinking about a citywide system response to the challenges that winter presents. And reality is, it's beyond winter; it's a seasonal challenge. I mean, we've had over recent years had particularly warm summers, which have created problems in terms of the health and well-being of the population, which have then in turn created pressures on healthcare across the whole system, from primary care through to the acute services. So it's more of a seasonal issue now, I think, rather than just a winter issue. This year, obviously, the context is very different because we've got the impact of COVID. That presents both inevitable challenges, and we've lived through many of those challenges over the past 6 months, but also on the basis of the learning of the last 6 months, it also provides some opportunities to change the way the system responds to and includes the third sector more actively within its response to pressures on the on health and social healthcare particularly. I'll just set a bit of context because I know we're short of time, but the winter planning cycle started this year in July and August. There were 2 workshops which I attended, and those workshops identified a number of opportunities and challenges across the system. When I say the system, the primary focus, the primary focus inevitably is to reduce pressure on, particularly on the hospitals, on the acute care, reduce the demand there so you don't have people receiving treatment or waiting for treatment on trolleys in undesignated areas and ambulances, those sort of things. So they're the things that are really sharply focused. But in terms of the challenges that were identified from those workshops, were really around the resilience of the workforce, and that's across the whole sector, including ourselves, making sure that the capacity that there is across the system is maximised, and that wherever possible, people or resources are moved around to ensure that where there are pressures, that we can be flexible in the way resources are deployed. Responding to changing guidance, and I think we've all lived through that the guidance around COVID has changed, and particularly in relation to what you can do face to face, what PPE you need to use, what services can be delivered and which can't be delivered. That guidance has changed very quickly, so the system has had to respond very quickly to that changing guidance. And as Caroline referenced, the likelihood is that Leeds will be subject to some form of local lockdown, which in itself will make us return back to some of those challenges that we've been living through potentially over the last 6 months. The other point that Caroline made was around one of the challenges into the winter period of this financial sustainability of the system, and particularly a recognition that the resilience of smaller independent organisations like ourselves is of significant concern. Some of the opportunities that were identified from those workshops were obviously the move towards more technological responses to healthcare. There's, I think, a recognition that there's a greater appetite for change, and organisations have responded quickly to demands and pressures. And that again includes ourselves, and that's recognised that the third sector has responded very quickly to the impact of COVID. And so that was, that's something is seen as being an opportunity when planning for this winter. There have been some innovative and collaborative ways of working that have emerged from COVID, and they should be taken forward. And really the shift, because the hospitals across Leeds were very quickly, and it was I know there were impacts on this, but there was a shift away from people receiving treatments in hospital to receiving treatments in their own homes or in the community. So I suppose the view was Leeds has demonstrated that it can do that. Can it replicate that through the winter period? So what the challenge for organisations working the system was then to, and I know the template was circulated to the group, was to put together their high-level winter plan. And we've done that for Age UK because obviously we're involved directly within the system and delivering services within the system. So we took on board what were forecast challenges in terms of peaks and troughs and the likely impact of a spike in COVID cases anticipated Firstly, after the return of children to school, and obviously the university is coming back in the next few weeks as well, so that was anticipated there would be a spike in late September, early October, potentially another spike into the early new year, and then one later on into the into March time in 2021. But also combining those spikes with the usual seasonal demands and pressures of things like children becoming unwell, so pressure on children's services, pressure on A&E as a consequence of children reporting there, but also the likelihood of there being seasonal flu and what impact that would have. What Forum Central have done on our behalf is produce a more of a narrative response to what the third sector can do and will contribute over the winter period. And I think the wider message to the system is that, as Caroline's referenced, that the way the third sector worked collaboratively through the COVID period, there's no reason why that shouldn't be replicated through the winter period, through the community hubs that have been developed, through the neighbourhood networks being seen as being a resource that can facilitate support for older people within the community, with reducing the demand on healthcare because those people are being supported. The benefits that the third sector provides in terms of being able to address health inequality, which was identified as a significant challenge across the system, the breadth and experience that the third sector brings, the reassurance that it can offer to members of the public that don't always that people don't always receive and experience from working with the statutory sector. We also provide a wider perspective, a different view, a different point of view, and a different way of resolving challenges. We have greater reach within the locality, and through our engagement in the community are able to draw on assets that the statutory sector can't necessarily draw upon. And we've also demonstrated that we're adaptable, creative and responsive to change. So those sort of things have been highlighted through the CCG, who are leading the planning for this winter. I haven't yet seen the final version of the citywide winter plan. That is now being put together because the deadline for submission of responses to the request for localised and organisational level winter plans was the end of last month. Once that's received, we can share it. I think we can continue to build on this as well, because whilst there are forecast pressures through the winter period, that may or may not come to fruition. Having said that, last year's forecast that was generated by Leeds Teaching Hospital Trust were quite accurate in terms of when they anticipated peaks and troughs for themselves and what that meant for the system as a whole. So whilst there is a degree of latitude in terms of the forecasting, I think there is also a degree of confidence that it will be reasonably accurate. So as a consequence of that, I think we continue to build on the winter planning. This isn't just a single opportunity to contribute to it. It's being ready for and able to respond to some of the challenges that winter is likely to present. That's all I wanted to say. Pippa, is there anything else you want me to cover?
I think that's really great overview, Ian. Thank you so much for being our stalwart rep kind of year in, year out, because these are difficult conversations, aren't they, to kind of keep that kind of third sector perspective. And it does feel really positive that it feels like we've been able to move that on in some ways. I think it's really interesting the point you make about digital and that use of data, and how as a system we are sharing information that actually then becomes helpful for every other part of the system. And that's certainly one of the reasons I know why we've tried to make the third sector contribution more visible, because that in turn will help people to kind of get a fuller picture and to do that. And one of the other things that we haven't mentioned is, but we had a lot of detail on it last time we met, was around the digital work and making sure that third sector organisations are part of the Leeds Care record, and the work that Danny Mistry and that IG post, information governance post, is doing on behalf of the third sector. So I'm really glad that you made that point. A couple of interesting points in the comments. Tina, would you like to mention the work that you're doing around workforce? And then Kerry has an interesting point around demand and how the admission are affected. Tina.
Yeah, so so Rachel Koivunen and I have been sort of collaborating on around how we see our place in achieving the Leeds plan and the left shift that's been talked about, and we decided that actually if we were really going to make this happen, well, there needed to be an aspect of upskilling our support workers. So we've made contact with Gaynor, I can't remember her surname, from the CCG. I had a big discussion with her. Then I've been working with Leeds Community Healthcare Trust, and Karen, you were involved in that meeting. And just to say, how can we get access to either existing training or training that's in development and influence that to upskill our support workers so they are the equivalent of really expert patients. It's not that we want to turn them into professional health carers, because that's not appropriate. But if we can say make them into patients on long-term conditions, then that offers the opportunity to reduce the involvement with the healthcare professionals where that's appropriate, but also involve healthcare professionals when that's appropriate as well, so people don't leave it too late and become more complex cases than they need to be. So we feel as though that's one plank of the workforce development, but there are other planks that will need to happen as well. So that's why we're involved with the information governance pilot that you've just mentioned. But there will be other planks which we'll gradually work round to. But achieving any of that left shift, we feel as though it needs to start with some basic upskilling in different areas for our support workers, and so that's
brilliant. Thank you. Those are really great points, Tina. Thank you. And I think that sense of the sort of value of the expertise and knowledge of the workforce, which has sometimes been a bit neglected, hasn't it, in terms of least heard voices within the system, actually. So really great that you and Rachel from People in Action are doing that piece of work. Lee, did you want to come in on Tina's point, and then I'll go to Kerry?
It wasn't really Tina's point. It's a question to Ian. About the flu, the seasonal flu. I mean, have we any idea as a city how we're going to respond? Are we going to respond to it different this year to last year? And if so, is there an expectation that the voluntary sector will get involved? So obviously there's going to be I'd imagine greater enthusiasm for getting people to have the flu vaccine. But is there anything else beyond that?
I'm aware that through links with some of the primary care networks and the LCPs that they are setting up drive-through flu vaccination centres. And there was a suggestion, I don't know how far it's progressed, that the voluntary sector could be included in assisting with those centres. They're obviously looking to increase the take up and manage the capacity, but manage the provision of the flu vaccine in a safe, COVID secure way. So that's what they were planning to do. But I don't know how far that's progressed, Lee. But that was certainly Alicia's got some.
Yeah, we can certainly find out and come back. I know there have been some discussions about that. There've also been discussions around just different building provisions. So, for example, I know in the Armley area, they're looking to use potentially the leisure centre, so they've got a much bigger space, and there's a huge amount of kind of time and effort going in, obviously at primary care level, to both as you say, Lee, maximise the sort of interest that people might have, but massive challenges in trying to do that safely and securely, and also widening out the offer to everybody over 50, I think, isn't it, and some of those. So yeah, we'll make sure we come back with a clear update on that, because it is a really important area, isn't it, and something, like health checks and a number of other areas where the third sector potentially could contribute, but there will be a capacity issue, and making sure that there's some resource for that. Karen, were you wanting to come in on that?
Yeah, I was just adding into the comments in case I didn't get a chance to come in, but the conversation that we initially had that Tina was talking about then was with Nina Davis, who's the project lead from LCH, who's working on the integrated long-term health conditions training and development programme. So just to echo what Tina said, that conversation is ongoing, and we've sort of suggested some kind of pilot scheme with People Matters and People in Action support workers to join the cohort of folk that have been offered that training, which is still currently in development. It won't actually be ready till early next year. So
yeah,
but that conversation is still ongoing.
Thank you, Karen. Yes, and again, it's that opportunity, isn't it, to demonstrate the ways in which the third sector has been able to rise to other challenges. There may well be potential, and there's some brilliant work that Kath Roth led around the volunteering cohort and voluntary action leads. The Leeds Community Cares volunteers has been an incredible demonstration of how local response actually has often been much more effective than the national. So again, trying to build on that, but trying to do that in a way that's sustainable.
Yeah, I think it's I was just going to say, I think it's about workforce training, isn't it? It's about utilising and widening skill sets, but it's also that ability to strengthen partnerships with statutory providers and people within organisations like Leeds Community Healthcare as well. So there's quite a lot of scope there.
Yeah. So definitely something for the strategy launch event. We've got some places left if anybody hasn't booked onto the Leeds Community Healthcare strategy, because that will be an opportunity to talk through some of the practical aspects of that. Ailsa, did you wanted to come in, around, I know Opal are liaising with the local pharmacist around flu.
Yeah, hi. Not much more to add at the moment. We've just sort of agreed to have that conversation to try and facilitate the flu clinic here. Obviously, we've got much larger premises than the sort of local GP or pharmacy, so we're hoping we can sort of facilitate that. So, yeah, it's to be worked out logistically, but hopefully we can manage that.
Brilliant, thank you, Ailsa. Yeah, and another great example of that kind of collaboration and using assets, including buildings-based assets. Thank you all so much. Really appreciate all of the questions and comments and engagement with, a wide range of different issues that actually have a lot of really common themes about where we can work together and make best use of our collective resources. We will send out notes. If anybody doesn't want to be part of a recording of today's session, let us know and we can edit you out, pretend you were never even here if you like. But really helpful way we've found of people that haven't been able to come to meetings to kind of catch up. Massive thanks to you all, and huge thanks to Daisy for pulling together the meeting and writing it up and making sure that the information goes out to all of our members. Do let us have any other comments and suggestions. Brilliant as always to see you, and massive thank you for all of the amazing work that you're all doing. Look forward to seeing you again in a few months. Thank you. All the best. Thank you.
Thank you.
Thanks, Pip.
Bye.
Bye.